The important topic we're gonna start is the burning mouth syndrome. Let's start it. Bismillahirrahmanirrahim. So it is basically very important. Actually, it can be asked in your competitive exams, in Viva, in the questions, MCQs, etc. So basically, the patient has the from the name you can consider it. This is burning of their tongue basically. Then glossopyrosis again, it is burning. It is actually different types of the words used for the same thing. Glossopyrosis is basically burning of the tongue. Then glossodia is the pain. Somatodynia is basically for the body pain, and glossalgia is again for the pain. The different words are used for the same thing. Okay, then basically it is associated with the burning and painful sensation in the oral cavity with clinically normal mucosa with no known organic cause. The cause is unknown basically. There are some local factors like allergy with the dental material like resins, dental mechanical irritations, and like bruxism clenching. There are some infections like or bacteria like candida albicans, fungal, then porosporochites, myofascial pain, and geographic tongue. In geographic tongue you have also a pain actually. Then in systematic factors which affect basically like in monopause you have, in diabetes the patient has, in medications some people medication and it is a side effect of that. So basically, xerostomia due to irritation. It can also be due to xerostomia. Systematic factors which is involved in the basically of burning mouth syndrome. It is this basically. Vitamin B deficiency can cause iron. Folic acid deficiency, ferritin levels are important. Psychological stress, anxiety can cause this syndrome. Then clinical features like 50 plus patients has. This is more common in basically more common in males basically. Sorry, it is more common in females, and the 50 plus ages basically there's a constant severe burning pain and often bilateral and present for months to years. Pain is relieved by eating, very important. When you eat something it is relieved by that. Tongue involved, but any mucosal may be infected, and dry mouth like an utter taste despite the consistency and severity of pain. Sleep is not effective, very important thing. Okay, now diagnosis include the, in diagnosis we do hematology. We will do the blood test to see the for thrombocytopenia, for any like, and then we will for ESR we will see. Then thyroid function is we will see it. Then examine the dentures, whether sometimes the dentures can also cause this syndrome. Salivary flow test to see whether the patient is does not have dry mouth or not. Examine for para functions like basically bruxism, clenching, swab or smear culture sensitivity will take. Okay, psychological factors like we have cancer phobia. Ask the patient to rate their fear of cancer on a scale of 0 to 10, that he is fear of cancer or not. 0 indicates not at all fear, 10 is overwhelming concern. Sorry, it's about concern. Okay, it's not cancer, sorry, concern basically. And regular self exam of mouth by observation in a mirror may suggest cancer phobia. It means you have actually like okay, sorry, it was cancer because you think you have a cancer. So some people are even are so much afraid of the word of cancer that they think they might be have cancer. Actually, patients may have a friend or relative who have been diagnosed with cancer. That's why. Then their disease is like psychogenic burning mouth syndrome. You have deficiency of like vitamin B, folic acid, iron, infectious skin disease. Then you have actually a denture discomfort, dry mouth allergy, diabetes. Treatment is psychiatric assessment. You take the patient to the psychiatric actually. It is then antidepressants, cognitive behavior therapy, and treat according to the cause. What is the cause? If the patient is feeling pain, you should treat the pain, or it is like this. Then we will talk about atypical facial pain. It is basically referred to a mixed group of conditions defined. Okay, diagnosed by exclusion of other typical patterns of facial pain. It is characterized by deep, poorly localized, atypical to distribution of sensory nerve. The cause is unknown. Psychogenic means it is related to psyche, to the patient's psyche. It is occur in patient who suffers from depressive reactions, hatria or schizophrenia. Okay, means it is different types of patients' fears. He think. Clinical features, they are more common in women like okay. So an elderly man, mainly affected, absence of organic sinus and poorly localized, continues for years to months, and this is basically unchanging pain. Non-anatomical distribution, sleep is not affected. The pain may cross over the midline of the face. Bilateral means it can be bilateral and crosses the midline, involve two or more sensory nerve field. Description of pain may be basally and crawling over the face. Declusional symptoms occasionally associated, and lack of response to analgesic. There is no response to any medications. Lack of any triggering factors. There is no triggering factors. Some good response to antidepressants. Patient may present detailed written list of problems. Cranial nerve intact. It is, and basically there is an inconsistent or variable response to vitality test management. Once you are diagnosed with this, you should have a cognitive behavior therapy. Okay, then refer them to the pain clinic. Listen psychiatry means you have to refer the patient to the psychiatric, so he can have a psychotherapy, anxiolytics, antidepressants. If the patient is depressed with continuous pain, may attempt suicide also, so you should have detailed. Can be used like clonazepam, fluoxetine, dorsolapen, gabapentin, and you can also use nortriptyline, these drugs. Okay, so basically these pills are related to the patient's psyche. There is no very definitive cause to these type of actually diseases. It is actually you have to take the patient to the psychiatrist so it can treat it. Do not take it even lightly, because it can, the patient can do it can be worsen, and you have a very bad type of situations and conditions react as a outcome of this.